one of the most effective therapies that's ever been generated in cancer is the bone marrow transplant. So for those who don't know, a bone marrow transplant is when the oncology team gives super high dose chemotherapy, obliterates all the bone marrow. So this is the cells that make your red blood cells, your platelets, your white blood cells that fight infections. All those cells die off. But before you did that, you took some of those things from the patient. Once they all die off, you kind of re-inject them to regraft all of the bone marrow. So the idea is that you kind of kill off all the cancer, and then, in theory, whoever is giving the marrow back, sometimes it's yourself, sometimes it's other people, but that can restore a normal state. This can be useful in leukemias and things like that. So that is a crazy idea. Like, that is an insane idea. And the mortality rate when they first started this was not zero. I have a brother-in-law who underwent a bone marrow transplant and nearly died. Many people nearly die. Many people do die from a bone marrow transplant. So that was an insane idea. And it won a Nobel Prize. It was effective, it worked, and rightfully so. But someone had to say, yeah, we're going to do that, and come up with this crazy idea, and someone had to fund it. And the patients are in the hospital, which is very expensive. They're monitored, they're totally immunosuppressed. So someone did make that leap, and it was totally worth it. But, for each of those, there's 5 examples of someone who did a really bold thing and it didn't work out. And if you're the person who's determining who gets funding and who doesn't, which crazy idea is just crazy enough to work is a tough call. Like, you're just not going to get it right. It's complete gambling. That could have just as easily just killed everybody. I mean, really.
We hope you liked this video. To support cancer research and get clear, expert answers about cancer, follow us and visit crackingcancer.org to join the Cracking Cancer community.